joined yet.
Hi, we're just waiting. Okay, well, if the Conservative group are happy, I'll take my lead from you. I don't want you to feel that I'm trying to exclude one of your number. Okay. Good morning. Can I welcome Assembly members and officers here at City Hall and members of the public who are either here in the gallery or watching online. Today's meeting of the GLA Oversight Committee. Can I just remind everybody, if you have got a smartphone, could you turn it to silent? And also, if you have got an electronic device and it vibrates, can you not put it in front of the microphone, because that can be picked up by the microphones. I wondered if I could just ask the clerk if we have any apologies for absence.
Thank you, Chair. So we've had apologies for absence from Assemblymember Deval, and we've also had apologies for absence from Assemblymember Hall, for whom Assembly Rogers is substituting today, and we're expecting Assemblymember Best at some point joining remotely.
Can we move to item 2 on the agenda, which is declaration of interests, which is found at pages 1 to 4. Can we note the list of offices held by Assembly members? And can I just ask, are there any further disclosable pecuniary interests in specific items listed on the agenda? And I'm going to take silence to mean that there aren't. Okay, so there are no further declarations. Minutes of the meeting held on the 14th of December are found at pages 5 to 42 in your agenda pack. Can we confirm the minutes of the meeting on the 14th of December are correct? So I can now sign them as a correct record. That's fantastic. Item number 4, summary list of actions, pages 43 to 66. Could I ask Assembly members to note the completed and ongoing actions arising from previous meetings of the GLA Oversight Committee and the additional correspondence sent and received? Was that noted? Yes.
Could I just particularly note that the letter that we had on the Green Bond programme, saying that the minutes are not going to be shared, but they have just shared with us the topics that they're discussing. This does make scrutiny of the Green Bond programme quite difficult, and I think we do need to keep an eye on this going forward.
Yes, I completely agree with you. Obviously, we've had a bit of an ongoing to and fro with the LPFA, the London Pension Fund Authority, over a very similar issue relating to minutes of meetings as well. You know, in some cases it may be that there's something that is commercial in confidence or that they don't want shared more widely. In those circumstances, relating either to pension issues or green bond issues, then I still think we, as the Scrutiny Committee of the Assembly, should request that the matters are shared with us on a more private and confidential basis, and obviously we would then not share the matters further. So that might be a way forward for us to mention that to them. Because I don't know what commercial and confidence matters they might be discussing at that meeting. Assemblymember Pigeon.
Well, when we come back to looking at green bonds, we do have the power to summons, so we could summons those minutes and we would receive them in confidence. And I think we might want to do that to help enhance our work in this area.
Yes, we might mention the power of summons in the correspondence that we send them, and perhaps they might be shared with us on a confidential basis without the need for summons to be invoked. I think that might be the nicest way to approach that matter. And incidentally, we had originally thought that we might take the issue of green bonds at the next meeting as well in March. I've had discussion with Luke Webster, and I don't think we're going to be in a position to take that item in March. But I have been discussing with him, although I can't tie the hands of whoever is the chair from May onwards, the idea of something coming back in April, May or June, so shortly thereafter. With that discussion borne in mind, are people happy to note the minutes from the 14th of December? Thank you. Item 5 is our main item for discussion today, which is COVID-19. 3 is on the London Recovery Programme. So our principal item of business, we have guests who are going to share their expertise with us. And I'd like to particularly welcome our guests who are both with us here in City Hall and also online. We have Niran Mothada, who is the Executive Director for Strategy and Communications here at the GLA. We have Luke Bruce, who is the Recovery Programme Director from the GLA. We have Rowena Howie, who is the London Policy Representative from the Federation of Small Businesses. We have Alison Griffin, who is the Chief Executive from London Councils. Joining us remotely, we have Martin Machray, who's already online, who is the Executive Director of Performance at NHS England, and he covers specifically the London region, if I can put my teeth in and manage to say that. And we're very glad to have you already, Martin, because I think we had thought you might not be able to be with us until a bit later. We are going to be joined slightly later by Angela Spence, who is the Chief Executive Officer from Kensington and Chelsea Council, Social Council, and Angela will be joining us at 11:30. So we have a briefing which has been issued to all of the Assembly members, and so we have a variety of questions that we want to ask. But perhaps it might be helpful if Niran and Luke said a few words just to set the scene of what's happened. Niran, would you like to start?
Yeah, I'll start. Thank you very much. So thank you for your invitation to the committee this morning. It's been almost 3 years since the start of restrictions in the UK because of the Covid-19 pandemic, and just over 2.5 years since we began the process of recovery by bringing together the London Recovery Board and developing the London Recovery Programme. In that time, the board has met on 13 occasions, providing a vital space for the city's leaders to come together and drive forward London's recovery. The board agreed to develop 9 missions, unique partnerships across London's government, businesses and civil society to deliver a real change for the city. The board and programme have been a significant step forward for London. And I want to talk about the three main areas in developing essential partnerships. The first is around partnership working. We have transformed the working relationship between the GLA and London councils by working directly in partnership and deepening the way in which we work. As you know, the GLA and London councils, so the Mayor and Georgia Gould, co-chair the board, ensuring that joint priorities and strategies have been developed for the benefit of the city. And also through the recovery programme, 17 of London's leading organisations led by the NHS have also come together into what is now called the London Anchor Institutions Network. And these leading institutions have pledged to work together on procurement, jobs, skills and sustainability. We've also, in terms of what we have delivered, and this is just a kind of flavour of what we've delivered, the Good Work for All Missions has launched the £44 million Mayor's Academies programme, delivering 22 hubs that support the delivery of high-quality sector-specific training provision. The Propel Initiative, which is a collaborative fund led by London funders and is supported by partners such as Bloomberg, City Bridge Trust, National Lottery Community Fund, and supports 3 of our missions. And we've also got the High Street for All missions, and this is around High Street data partnership, which is ensuring that we work in collaboration on city data. And there are currently 22 boroughs signed up who access data over 100 times per month to support developing their local strategies. And in terms of the Green New Deal, we have developed the domestic retrofit programme that's led by Enfield, Walthamstow Forest and London councils to drive retrofitting of London homes and reduce carbon emissions. In terms of working together, we've developed the Economic Recovery Framework, building a Fairy City Action Plan, and also the board have come together to have a joint voice around key issues such as the Levelling Up White Paper as well. In terms of what's next, as you are aware, there is lots more to do. The city's recovery is not complete, but we also are impacted by other challenges, such as the war in Ukraine and the rise of cost of living and the impact that that has on London and its citizens. We also know that there are continuing structural challenges, including health inequalities, that still continue to persist after the pandemic. So we are now taking the Recovery Board and developing the London Partnership Board, which will be the next iteration of the Recovery Board. We will continue to focus on the 9 recovery missions because their ambitions go beyond, some of them go beyond 2025. And as you're all aware, the programme team, which we have in place, will step down because it was only ever due to be a 2-year programme team. But I am developing a new strategic partnerships team, of which this work will come into. Thank you.
Actually, I have nothing further to add, and Niran's done it far better justice than I could, so probably best to get into the...
Are you sure? It's your opportunity just to say a few words to set us off, but if you're happy not to.
One thing I would just say is that you introduced me as being from the GLA, and while the GLA has by sort of pay and rations, the team that we have working on this is a shared team across the GLA and London councils, and I think as one of the lessons we've learned is about that kind of much closer working and bringing staff in from different parts of London to work on across London programmes. And so I think when we look to some of the things we've learned, that's a really important area, and the link that we have with London councils and the boroughs has been hugely helpful.
Thank you. Well, that brings me on, actually, because my next question is, in fact, going to be to Alison. And if I can just remind you, when you're not speaking, to turn off your microphones and then turn them on, because otherwise they tend not to work quite as well. Thank you. So I'm going to turn to Alison now, and I want to ask you, how would you describe the main strengths but also the weaknesses of the London Recovery Board and Task Force, and what has happened differently because they were in place? Obviously, Niran set out what has happened, but how has that been different?
Thank you. So first of all, thank you for inviting London councils and all of the different partners around the table, the Recovery Board table here today, to give you some evidence and insight of how we've worked differently. So I think the first strength I would talk about is absolutely the co-chairing between the GLA, the Mayor, and our Chair, Georgia Gould, who's also the leader of Camden Council. I think that set the Recovery Board off on the right footing of showing that we did want to work differently, and that's one of its strengths of sharing and setting the agendas. As you've heard from Luke already, a joint team in place, very much, yes, the GLA were paying the pay and rations, but absolutely from the outset, how is that team shared across? How are we working differently together? And the Recovery Board has given, I think, that platform for a different way of working, and that has been our strength. Also recognising that no one organisation could solve the issues that London is facing as a result of the pandemic, and indeed gave us a platform to look at some of those longer term structural inequalities that we know the city has been facing together in a different forum than we've done previously. I think the mission framework also is a strength of the way of working, because what it enabled organisations to do, including the boroughs, was to gather round those issues that they know were really pertinent to their residents, like high streets, like ensuring you have good work for all, that there is a safety net for every citizen in London. And we know that the different organisations round the Recovery Board table can bring some different perspectives, expertise and strength to those areas. And it's by working together in the way that we have been over the last 3 years that I think has really lent itself to a platform now to continue that work and change the city, and with some really tangible examples. So for instance, on the digital inclusion mission, as we were sitting around the board table, hearing about the work of ensuring that over 150 voluntary organisations now across London are able to ensure that citizens who are digitally excluded are getting the training and insight that they need to make the most of the digital revolution that we touch every day. Look around us, having a hybrid meeting here. Organisations started to volunteer their old devices in the room, and now that means 800 at least citizens who didn't have the tools to be as partly digitally connected now have them, and that's the start of getting London Online programme, and that will continue to grow. So it can sound very strategic, can't it? And it should be, because it's a pan-London board. But it then, I think, demonstrates our working together has able to harness the resources we have in London, the talent and the skills to really make a difference. You asked me about weaknesses. I tend to think about, well, where are the areas for development rather than weaknesses? I think some of it was bumpy. Not everyone could gather around all of the missions in the same way, and nor should they have done. And I think we've learnt that and matured as a partnership to understand that different organisations, individuals, are going to play to their strengths in this space. But that's how you build coalitions to get things done. So I think, again, that way of working is something for the future. I think we've learned a lot about the different roles we can play and a recognition and a respect of the different tiers of government in London. And that might not have been as mature as it was, I think, pre the pandemic. We've also strengthened our relationships, I think, from a borough point of view, with the health colleagues in working with and other public sector colleagues, not through the work just of the work of the Recovery Board, but during the pandemic. And we could bring that to the Recovery Board, and I am confident we will now bring that into this next iteration of a partnership board for London. So they're just some of the things, like I said, I could probably talk all morning, Leonie, so I'll stop there. No doubt we'll come back.
You probably will get to talk all morning, but I suspect there might be some more questions that come in at various points as well to encourage that. I'm actually going to turn to Luke, and then I will come back to you, Alison, again. How well, from your perspective, obviously speaking positively here about partnerships, but how well, from your perspective, have the governance arrangements, obviously quite complex board structure, including having co-chairs, how have they worked in the recovery programme? And can you identify any lessons learned from your experience of them in practice? You know, feel free to build on what Alison has said or bring in other things.
Well, there is an inherent complexity in this, and I think it's right to start with that as our sort of base. And London is a very complex place and has a governance, a government system that is complex. And I think there are probably two or three points I'd highlight. I mean, firstly, the relationship with the two co-chairs, I think, as Alison identifies, has been an absolute strength in this process. And working directly with them and their offices, and then their officers that support them, there has been a sort of shared understanding of the challenges facing the city, a shared understanding of what we were trying to achieve through the board. And that is a lot of that is down to the governance, but it's also down to personal relationships, and it's down to the willingness of officers and staff supporting the co-chairs to support and help that. And I think that building the relationships has been really important to underpin the strength of the governance. I do think there's a sort of the part of the challenge that we have faced with the governance is the sense that the partnership. The Recovery Board and then into the Partnership Board, it has a lot of very senior people on it, and it takes a very strategic view. And we've had to find ways underneath that to progress the work and take the work forward, which just doesn't sort of bung us up with committees and terms of reference and governance and things. And the task force played a really important role in giving us a space to kind of review and take stock and deal with some of the kind of the more technical elements to it. But the thing that I would really identify as kind of a lesson learned is that, whilst you definitely need to have a firm structure in place, and you need to respect the reporting and performance management lines of the partner organisations, and that's been really important. We're not trying to duplicate their role. We'd get into some trouble if we did, I suspect. But what we have found is that the more informal working groups, the kind of task and finish groups, bringing people together to work on a problem, giving people kind of a structure in which to work, whether in the missions or outside of that. So I think of some of the work we've done with the business community, for example, I think has been hugely important. I think, probably getting the balance right between formal governance and informal relationships and understanding has been the key to the success of what we've achieved.
Actually, before I come back to Alison, I'm going to bring in Rowena, because we've been hearing a lot from the GLA and London councils, or the sort of joint GLA London councils perspective. Do you feel, as someone not from either of those organisations, but from one representing a different sector on the board, that the Recovery Board membership has properly reflected all of the key sectors and interests in London's recovery? Could some voices have been strengthened during the process, notwithstanding the points that have just been made about voices being strengthened with particularly health colleagues?
Thank you, and thank you for the invitation to be here today. Did it reflect all sectors? Well, being from the Federation of Small Businesses and one of the business organisations, I was glad that we weren't the only business organisation in the room. I really thought that it was good that you had multiple voices in the room and reflecting different experiences. And as the business, as small businesses represent over 99% of the London economy, I thought it was really important that Federation of Small Businesses be there from my organisation. But it's important that everybody else in the room recognise the value that we bring too. And I think that was really important, a part of why it was valuable to take the time to be present, to be consistently there throughout. And that was the cross-pollination of ideas, the ability to come round a table, albeit a virtual table for most of those years, and really begin to sort of coalesce between shared goals. And I thought that was a really important point of the Recovery Board. Having sat at every single meeting, did you just say 13 or 14 there? Having been there at all of them, I mean, maybe I saw the addition of new persons, but in fact, around a virtual screen, sometimes you just didn't see faces as much. But I began to see more people added, particularly, I think I recall that there was more disabled representation later on. You started hearing more voices from the deaf community, and as Federation of Small Business has actually put out a report and identified 10 steps that we recommend to progress the disability entrepreneurship, and that being a really important point for the future. All of that sort of muddles together in terms of your question of representation of all sectors. I mean, I should also add that, as the Federation of Small Businesses, and that includes implicitly micro businesses, and the experiences can be different of the two, and the fact that that is across every industry and every sector, and as we've just acknowledged how diverse London is, we are reflecting members from many different backgrounds, and sometimes it's not as simple as providing a straightforward answer to a question that reflects all small businesses. There are nuances, and it's been really important to be round the table and be able to actually get into a little bit more of the nitty-gritty and maybe reflect a more complex view.
We completely appreciate that it would be impossible really for either you or the LCCI, the London Chamber of Commerce and Industry, to come along and speak with one voice on behalf of so many multiple members. It was really more about whether or not you felt that you were sufficiently represented and heard, and also whether there was anyone that you felt was missing. And it sounds as though you're saying that you did feel heard, even if you sometimes speak with multiple voices, and also that you felt that as things progressed there were other voices brought in. So that was an improvement as we went along. So coming back to Alison, do you think that the Recovery Board had sufficient teeth or powers, whichever you prefer, teeth or powers, to achieve its intended impact in London? And could it have benefited from any clearer or stronger powers along the way? And don't forget, my questions are all reflecting, if you like, into the past. We will have some where we're reflecting into the future. But it's interesting, I think, to hear whether you feel that it did have enough powers.
So I think from a borough perspective, from London Council's perspective, it had the powers and the governance it needed to do the work during that time. So maybe we'll get into some of the future. And why I'm saying that is because actually, as we've heard, through the co-chairing, we were able to build some shared agendas and shared vision, but not just with London Councils and the GLA, but also the other partners round the table. And I think the missions framework enabled us, as I said in my opening remarks, enabled us to gather round those issues that we felt were the most important. The evidence was saying to us were the most important for residents and businesses in London to recover. I think the issue of powers is always, you think, oh, should the Recovery Board have executive powers? Well, that would be add an additional, from my professional advice, additional level of complexity that Luke was referring to, where actually in a partnership, what the power you're bringing, or the powers you're bringing, are your individual organisations or representative organisations' power to the table, and how can you work together to make the most of those powers and have that impact. I think trying to, if this is where your question is going, and maybe I'm misinterpreting it, think that there should be additional executive powers for a kind of partnership board in that way, I think actually potentially could dilute the kind of joint working you need to solve some of London's challenges.
Just an open question, really, just to sort of
trying to bring, so I think it's recognising that each organisation and institution round that table, but also, not those just round the table, but those connected to the networks of those that are in that table, all have power and agency in their own right. And it's how you blend those together in a missions framework that brings, I think, something new to London that we know is complex and is always going to be because of its scale and our history. So I would have been, I think it would have been actually a distraction from getting some of the work done if we were spending a lot of time trying to think about what power should this new partnership organisation, not organisation, but group have.
Happy to. I just wanted to see if Martin wants to come in at all. We didn't originally have you listed as someone to ask questions at this point because we didn't think you'd be with us. But as you are, any thoughts about the partnership and how it worked for you and the bringing together of the different sectors?
So very briefly, Chair, to two further points to the set of questions I think are worth adding. On the you asked about weaknesses. The weakness we always, I always fear, I'll personalise this, is that we spend a lot of time talking about stuff and not doing things. And what the board has allowed us to do has to do things at pace together. And I would be reluctant to say there were positives if all we did around was posit on what we could do. And what we've seen is things happen. And one of the things that we haven't mentioned yet that we've been able to do as a partnership through the recovery.
Oh, we'll
Sorry,
never know what it is. Oh, you've come back. You've come back.
Yeah, don't know what happened. So we've been able to paint a picture to government of a united city and a united region. And that has been enormously powerful, particularly in the first 2-3 waves of COVID, but subsequently too, where we've been able to show that London, be it from business, from community, from the public sector like myself, have the same ambition to grow this great city and make it better. And there are advantages to all of us for doing that. So that I think that just needs underlining. And then just on that last point, if you had said we want to make this a committee or a board with more executive power and more authority, we would still be discussing today the terms of reference. And I'd rather we got on and did some work.
Well, I suspect you probably wouldn't, because I believe during the period of the pandemic, Martin, that you were quite busy, because I saw you quite a lot during that time. So I don't think you would have been taken up with that, but perhaps someone else would have been. I'm just going to see if Assemblymember Pigeon wanted to come in. Did you want to add something at this point? Or inquire about something at this point?
No, I think I'm going to come in at the end of
a bit later.
Thank
in
you.
Which case, thank you very much. I'm now going to pass over to Assemblymember Rogers, who's going to pick up some further points.
Thank you, Chair. Question for Niran. Going back to the discussion we had earlier on the sort of membership of the board, which has got representatives across the political spectrum. You've got some very senior public sector officers on the board as well. What impact, positive or negative, has that had on your ability to make the case for to national government around London's resourcing needs?
Actually, I think it's made a really good difference. So throughout the pandemic, probably setting aside the beginning of the pandemic, but certainly as we got into transition, so alongside kind of the SEG and the Recovery Board, we also had this transition board that sat in the middle, and this was the transition from from COVID, where we were, into kind of recovery, and this was out of lockdowns. And actually that board was co-chaired between the Minister of London and the Mayor of London as well. And actually that partnership working continued through into the Recovery Board as well. And having their presence there, hearing firsthand, both from transition and from recovery, as to the issues that were arising in London. Because, I mean, having come from central government myself, there is something about kind of really understanding kind of the local issues and the local issues that impact on a city of 10 million people. And that's all the way through kind of some of the disproportionality that we were facing, all the way through to, and I think, and I hope that they took away a better understanding of London and London's demographic. The other benefit, I would say, as well, came from the joint letter that the Recovery Board wrote to government on levelling up, and kind of London's position on that, and having that stronger voice. And what I would say is their engagement in the board continues, and we hope that it will continue, because for us it's really important to have them there around the table and actually listen firsthand to the work that we're doing and how we are helping ourselves as London, but also the help that we will then need from them in terms of kind of their development of policy making for local areas.
I wonder, you had representatives of, I think, three political parties on there. Did you see that cause any kind of friction? Were there political disagreements, or were people kind of very much focused on the mission and sort of putting aside party lines?
I think Luke can probably better answer that, but there will always be disagreements. I'm not saying for 1 minute that it was perfect all the time, because it really wasn't. And we had some really good involvement from a number of those political leaders and local political leaders. Ruth Dombey being one of those, who was a huge advocate, particularly and continues to be, particularly in the space of disproportionality. But yes, there would always likely to be tensions, but Luke will certainly know more.
So, I mean, I certainly never really perceived people coming at things in a sort of party political way. There were certainly differences, and some of that's to do with the geography of London as much as it's to do with the party political. I think the point that I would make, particularly in some areas, having voices which were closer to government and able to make the argument to government because of their political background. So I think of the work that Alison's team and with Alison's we've done around the shared economy framework, and the role that Councillor Campbell has played has been hugely helpful. And part of the learning for the GLA and for other partners is to know when to lead and when to be led and when to step back. So I think that's actually been a strength rather than a weakness.
That's good. It's encouraging to hear people putting party aside and focusing on the city. Moving on and back to you, Niran. How is the Recovery Board capturing the learning from its response to the pandemic so we can make sure we maintain institutional memory?
Yeah, so we're at a point in time now as we transition from the Recovery Board to the London Partnership Board, where we are taking stock and learning lessons from what we have built, how that worked. We've touched upon some of the good lessons that we've learned in terms of kind of our partnership working. The one word I would use is care. So I cannot underestimate the work that the recovery programme team have done in terms of kind of taking care and kind of building those relationships. But at the same time, we were in this, as you know, whenever there is a major incident, you always think about recovery. In fact, on the day of a major incident happening, this was very different to any major incident we had ever faced before in the sustained nature of it in itself. But we did start thinking about recovery quite quickly and quite early in the process, and that is something that we will absolutely take away as a key lesson. The one negative in terms of kind of some of the lessons, and I think it was touched upon before, was the development quite quickly of our missions. And what you will see is that those have had to be developed and adapted over time, quite rightly, because they were developed in a moment in time. And there is something for us then about kind of if we were in this space again where we had this, we would need to think really carefully about how we wed ourselves to kind of a particular set of missions, and then how those will need to change and develop over time, and how we bring our key stakeholders with us through that process. So what I would say is throughout this process we have absolutely done a lessons learned. We will take stock as the Recovery Board transitions to the London Partnership Board. Just so you're all aware, we will publish what the Recovery Board has achieved against those missions in the fullest as we transition through, and we will absolutely take that learning into the next phase, and also capturing in terms of kind of what we do if we're faced with a similar situation again. So
that's an interesting point, isn't it? Because this was the pandemic, the most significant resilience event in the city for decades. Yeah. Very much unprecedented territory. And when you talk about the missions, I'm getting a sense that you think that perhaps they were developed too quickly. Was that a result of pressure, or a sense of we need to be seen to be doing something, or trying to get ahead of a curve? Where did the pressure come from there?
So I think I don't think pressure is the right word. I think it was more about the fact that we knew quite quickly. I mean, even when you looked at the first lockdown, and the period of time that happened, that there was going to be a period of recovery. That was, I mean, you cannot kind of close down, economies and everything else, and not expect there to be some, some issues and even some long sustainable issues. I think it was more about the fact that we knew we needed to do the work and do the work quickly. And I think that perhaps there is something about the fact that what we developed, and as not knowing at the time how long this was going to go on for, and the other issues that were going to arise. And one of them I would say, and I keep coming back to this point, the disproportionality point was far greater than I think we ever anticipated. And I think also, when we think about the missions approach, the one good thing is that we do have a number of cross-cutting principles, and the cross-cutting principles I think for us were really key, because it kept pulling us back to kind of, do these continue to be the right things for us?
Okay. Luke, I think you wanted to come in.
I'm going to just emphasise the changing set of issues that we faced over these 3 years, and I think that none of us expected when the missions and the programme were set up that we would, there's obviously more recent things, but even early on in the programme, we had a sort of view of employment and what would be happening in the city around employment, which turned out just to be wrong. And we weren't the only people that didn't get that right. No one foresaw the fact that actually we were going to be seeing a sort of inflation skills kind of crisis. We thought we were facing a major unemployment problem. So we've had to adapt and change. And I think there is something about the kind of agility that public bodies and public policy needs to build into the way it works, which, you know, I think we still need to do quite a lot of thinking about what's the right structure for that.
Yeah. Thank you. Luke, question for yourself. What legacy arrangements are in place to respond to future pandemics? Of course, we hope that doesn't happen.
So are we talking about the response to a pandemic as opposed to response to the recovery to a pandemic? So I'm a bit stuck on the response to the pandemic. It's probably out of my area.
Okay, no worries. Well, in that case, back to you, Chair. Thank you very much.
Okay, thank you. We're going to move on to Assemblymember Ahmad. Oh, sorry, was this where you wanted to come in, Caroline? Sorry, I thought it was...
To pick up from Niran, did you say that the missions may change in the new model you're moving to?
No, they have developed. So from the very beginning of what the missions look like, sort of 2.5 years ago, we have developed and adapted them over time.
They're going to stay as they are.
They will stay as they are.
Okay, I was
yes.
just a bit alarmed. I thought I'd heard that, and I thought, isn't our budget now based around these missions? And if you're suddenly going to change them, that's good to know.
We have adapted them over time.
That's fine. I've just misheard. Thank you.
Thank you. Actually, just before we move on to some more questions, can I just ask you about the strategic coordination groups? What lessons were learned from the initial response to COVID-19, including their work?
Oh gosh, that is a very big question.
It is. But in less than an hour.
That is a very big question. So there have been so at stages through the SEG, there were a number of lessons learned, and as in, you know, at every step. From my, and this is a personal perspective, the one thing I would say is that the ability for people, for partners to get around the table quickly and actually work together with one London voice, I would say was one of the most powerful and impactful things that I have ever seen in my career, and actually that in itself helped us, as I said, through the transition and now with the recovery board as well. And I think that the fact that we pull together in that way, and also in terms of all the structures that were put in place, was just phenomenal. The fact that people came together so quickly. I was part of the operations centre that was set up at Union Street. You know, we had the military there, we had comms teams there, we had the City of London there, we had the boroughs there. It was, you know, all socially distanced, I should say. It was incredibly impressive. But I believe there are things in place which set out kind of quite detailed lessons learned from the SEG, and as you know, there is a COVID inquiry that is going on at this time, which will also start to look at kind of how that local partnership worked.
Thank you, and that was in less than an hour. I'm going to Assemblymember Russell and then McCartney.
Sorry, I just wondered if we could get Martin's reflections on that question you just asked, because Martin was a key part of the SCG, and it would just be interesting to have that kind of medical, given it was a pandemic that the SCG was responding to. It would be useful to get that medical perspective.
Certainly.
Thank you. So I would say that the SCG that was established in response just under 3 years ago, as was said earlier, was a brilliant building block for what became the Recovery Board. In as much as the key players, not all of them, but most of the key players came together with one single mission, which was to make sure London was safe over this time of huge uncertainty. Now, we were able to do that well and quickly in London because London has, unlike other cities and regions, is faced with international incidents more frequently than elsewhere. I just turn your memories back to 2017 and what we experienced in terms of terrorism and Grenfell. and we have learned to work very quickly to react to a problem. And on the basis of that, the recovery board, the transition board as well to a degree, but more the recovery board, we were able to build on the relationships that were already there, but this time with a view to the longer term. And I think the SCG, of which we have had a number of others over smaller incidents since then, has benefited from the work of the recovery board, because we've learned more about each other and our organisations and about what we can do to support London than we ever believed before. I would argue in an emergency, you go into this and say, what do I need from these other partners so that I can do my job? And now we've turned that question a bit around to go, what can I offer to the partnership that will help London and therefore help me? Or help my organisation. So I think it's been a mutually supportive process, but I do think the SCG being quickly established and well functioning in the main has helped us launch the recovery board in the right direction with the right relationships.
Thank you, and thank you for prompting that, as we've got Martin here, that we could ask him that. Assemblymember McCartney.
Yes, I think Martin's probably covered one of the questions I was going to ask, and that was just the partnerships that have built up. And I'm just wondering, what lessons have we learnt for London's resilience, not just in terms if we have another coronavirus or health scare, but also if we have, for example, a terrorist attack. Are we now much stronger for the work that you've done than we would have been before?
I believe that we are, and I think as Martin has said, and he summed it up much better than me, the understanding of the strengths that each of our partners can bring, and as with all major incidents, right at the beginning, I remember right at the beginning, there was a little bit of like who should be doing what, and because we were faced with kind of multiple problems, multiple issues, sort of through this, and actually by working through those issues, and sometimes working through those issues quickly, we didn't always get it right. Sometimes everybody would want to get involved because that is just the really great nature of our partners. But actually having a much better understanding now of where each other's strengths are, where those levers are, and how we can absolutely benefit London through something such as that. We need to make sure that we capture that. It may be that, hopefully we never have to face something like this again, but it may be years down the road. But there is something about kind of ensuring that we kind of capture those lessons and how we have worked together. And we have tried to document as much of this as we possibly can.
And we are now going to come to Assemblymember Ahmad, who's going to pick up some further questions.
Thank you, Chair. Good morning, panel. And if I can just apologise for my voice, which I'm sure you'll be delighted to hear is rapidly getting better, but we're not quite there yet. Niran, with the addition of the UK Shared Prosperity Fund, Anchor Institutions Network, Economic Recovery Framework and the other initiatives all falling under the banner of the recovery programme, how have you ensured that this work has been communicated clearly to partners and to Londoners?
I may bring Luke into this as well, but we certainly publish as much as we can on our internet site. So all our board minutes, etc., are all published. I believe the economic framework is also something that's published as well. Yeah. So we're absolutely open and transparent in terms of kind of what we do and how we do things. We have had a number of set pieces where we have obviously done some publicity. We had the Anchor Institutions really great network event on Tuesday, of which we communicated some of that out to the public, because that's really important in itself. But is there anything else that we're doing? I mean, in terms of...
Well, look, each of the elements of the programme has a comms strategy and has a comms plan and has a comms resource behind it. I think it's important to think about this in layers. So there is a sort of outward confidence to Londoners and the City of London that there's a group of people who've got a grip of the post-COVID period, and just the symbolism of the recovery board, I think, is important in that. But then I also think that the value of the comms piece, and this is where I just spent a lot of time with our comms team think about is what are the networks that we are supporting amongst the boroughs, NHS, other partners. What's the comms work that we're doing to make sure that they understand their role in that. They are able to use their networks to communicate it. They're able to use collateral that we provide and push out further. So I think it's there's a confidence piece to Londoners, but then there's also a effective change management piece, which is the comms work that I probably focus more on, because that's the thing that gives us long-term resilience and long-term kind of change.
Thank you. Niran, you have gone into this a little bit, but I wonder if you can unpick it. What has been the impact of developing a recovery mission-based approach, and to what extent has this concept worked in London? Why is it better in London perhaps than somewhere else?
I'm not sure I could compare it to anywhere else, but for London certainly. As you're aware, the mission-based approach is something that was developed by UCL, and what it does is it focuses on a grand mission, and our grand mission was very much about kind of how does London recover from the pandemic. And actually, by taking a mission-based approach, it really enabled our partners to kind of come together around kind of very focused outcomes. And that in itself, I think, has been part of the key to our success in terms of kind of bringing people around the table around very, very specific, or not always specific, but fairly specific issues. And that's something that we've been able to track throughout. As I said, we are going to publish kind of where we are to date with all our missions. We do that here in the GLA for the missions that we are responsible for through our budget process as well. But I think the ability for partners to come round to something that was quite focused and fixed with this overarching challenge, because if we had gone in just to say we need to kind of like London needs to recover, that's massive. But actually kind of breaking it down into kind of quite a specific mission-based approach, I think, helped us enormously.
Thank you. Luke, why did it take so long, in some cases nearly 2 years, for recovery missions to move into the delivery of new projects and programmes? And what is the GLA doing to ensure that there are fewer delays in the future?
So I think that is a really good question, and something which we have spent quite a lot of time thinking about. I think there are sort of 2 or 3 aspects to that. I mean, firstly, it sort of goes a bit back to the point I was making earlier. Some of these missions were set up with a particular view and a frame of their kind of the coming years and months, and then we found we were back within a pandemic. So, for example, if you were to take the mental health mission or a bus safety net mission, the teams across London who were working on those were also then having to go back into response mode and back into dealing with a particular crisis. That certainly continues to be true of the teams across London who are working on robust safety net mission because of the cost of living crisis. Martin Lewis in City Hall today talking about that. So I think some of it is just the capacity of some of them to do it, and the fact that the ground was changing. Some of it is also these missions have to do a lot of preparatory work. So if I think about the Green New Deal mission, which has a target down to 2030, you think about, you were touching on green bonds earlier and talking through kind of what it means to have a retrofit program in place. Well, retrofit programs are going to require people to do the retrofitting, and therefore we need to get the skills, the skills academies up and running, as part of the response to that. And there's a heck of a lot of engagement with government on funding for it. So some of it is just about the sort of the program wave of these. But there are areas where I think, if I were to come back at it again, is probably thinking a little bit more about our delivery models and what we might want to think about kind of how we tracked some of that progress. And I think, in the context of those 2 years where there was a lot going on, it was hard to have that discussion at times. But I do think it's probably something that, for me, whatever, in my future, I will come back to as a sort of project director.
Thank you. Luke, your board meeting papers identify issues with funding not meeting the scope of the challenges that the missions are attempting to tackle. are the recovery mission visions and objectives realistic and deliverable in the context of those funding constraints?
I think it depends on the missions, is the truth. And, I think there are some missions, like the mentoring mission, which, I think there is a very clear path to getting to the target and a very clear kind of funding model. There are others, and I'll point to it again, the Green New Deal one, which I don't think anyone ever pretended or expected that we would be able to hit the sort of the targets that has, and without additional government support and the factors around the future state of the economy, which sit outside it. So I think part of what the missions have helped us to do is to communicate with government. We talked earlier about the sort of strategic conversations we've had with government, but also the missions themselves have provided a way of speaking with officials and more junior ministers on some of the practical points, which has helped us unblock things. Certainly in the area of skills, that's been hugely important for us. So I wouldn't sit here today and say that we have the funding in place for all of the missions to hit their targets, because inherently that isn't the case. I do think, and Niran touched on it, we'll be publishing action plans, refreshed action plans once the GLA budget is out, but that will give a sense of where we are on some of those targets and what that might mean. But we need more money if anyone wants to lobby for us.
Thank you very much. Thank you, Chair.
Thank you. I think Caroline Pidgeon, Assemblymember Pidgeon, you wanted to come in at this point?
Yeah, just pick up with you there, Luke. So you're talking about the funding issues. Can you specifically say what the Mayor has done in his budget to help you deliver the recovery missions that are short of funds? You already mentioned the robust safety net mission, which you've cited as an example of work that's really struggling to meet the scope of the challenge.
Yes, and I might draw Niran on some of the details of the wider GLA budget. I mean, we know that the Mayor has put more money into some of the missions, and that's a good example of where we've put extra both financial resource and direct resource into it. And through the funding through UK SBF and others, we've been able to allocate additional resources in partnership with government to programmes. High street programmes is one that springs to mind. The GLA's financial envelope is the one that it has, and has a lot of competing calls upon it. I don't think on some of the missions that the GLA should ever or could ever get to the point where it's funding them in their entirety. It's why the partnership is so important. It's why something like Propel, where we've brought together a collaboration of people to pull money together, including funding put in by the Mayor of London, has played has been such a significant leverage and additional funding. But I also know that where we have faced challenges and issues, and where we know that there are acute problems, we have worked with the Mayor's office and with other partners to find additional resources.
Yeah, so the missions continue to be funded through the GLA budget process, and will continue to be funded until sort of 2024. So that because that's as far as our budget goes out so far. But I think Luke is right. Some of this is about GLA leadership and the Mayor's leadership, but also the absolute principle of these missions is about partnership working and partnership delivery. So some of the delivery sits with us, and and our ability to influence and convene and lobby, etc. But also some of the delivery aspects of some of these missions also sits with partners as well. And what we don't do as the GLA, we're obviously not tracking the spend of kind of other partners and that kind of thing, because that is absolutely out of our remit. But we are still invested in our missions. The missions will continue. We absolutely need to continue working on those and working on the outcomes for those.
Okay, thank you. I might want to come in after Caroline Russell, because my other questions I've got, I don't want to tread on her toes, so I thought I'll wait, if that's okay.
Certainly. Just before we move on to Assemblymember Caroline Russell, can I just ask, do you think we got the right 9 missions. We've said that having the overarching mission, it was very helpful to get people to coalesce around the missions that delivered it, and I can see exactly how that would work, because saying come and contribute to London's recovery without being specific as to what you wanted people to contribute to is a bit vague. But did we get the right ones?
I go back to what I said earlier about lessons learned, and the missions were developed at absolutely a point in time, right, pretty much right at the beginning of the pandemic, and those have been developed and shaped thus far. And what I would say is that some of the missions were certainly absolutely felt like the right ones, and were much easier, I think, in terms of kind of the start of their delivery for people to get around and deliver. There were some others, and I think probably more the economic ones were I think in a space where there were kind of real tangibles that people could get behind and kind of push forward. I think the ones around kind of community and people definitely needed more development, and that is certainly a lesson that we will take away. I think where they are now, they feel like the right ones for what we need to do and how we need to continue to move forward. But as you will see, and I'm sure we'll talk about it in a moment, when we think about the London Partnership Board and what more we need to do for London, that is now about kind of the next steps.
Okay, I just thought it was worth reflecting on whether we got the right ones then and where they're going to now. But I am now going to bring in Assembly Member Caroline Russell.
Thank you very much, and good morning, everybody. So my first question is to Martin, which is just again going back to the recovery programme. So Niran's just been saying that some of the missions, were kind of clearer and easier in terms of deliverability, particularly at the outset. So the economic ones were kind of quite clear, whereas the more people-focused ones perhaps needed a bit more scoping. So, Martin, from your perspective, as one of the health partners, what aspects of the recovery programme worked particularly well, and were there any aspects that could have been improved?
Thank you. So looking across the 9 missions and the cross-cutting issues that we've talked about already, I think the ones from a healthcare perspective, from an NHS and a social care perspective, that have worked really well are the ones that we've invested time and effort in people and in Londoners. And that's because there is payback quite quickly for us, and it may well be the case, not my sector, but for Rowena, it may well be the case that actually investing in people and future skills and training is good for my organisations and my purpose as the NHS. We have a significant skills gap within the healthcare sector. We have significant vacancies, and yet we serve nearly 9 million people across this region, many of whom have not got the opportunity to work in high quality skilled jobs, and the focus that the missions have on a new deal for young people, for example, and good work for all, although they may not have made the measurable progress that we look for in some of the more easy to measure areas, for us, they are the ones where we have got greatest traction. So if you think about the learning hubs that the Mayor has invested in, and there's some just over 40, I believe, 3 of those are based sub-regionally or focusing on health. We'll soon have all 5 sub-regions having a hub. We will have a mirror social care training hub for each of those. And that is massively important to us. There is real payback for us, but there's real payback in 2 ways. So one is I get people who want to work in decent jobs and have career structures and career opportunity and hope. And that's great because I can deliver services, because as everyone on this committee will know, the NHS is struggling to meet the demands on its services, be that in mental health, be that in urgent emergency care, in ambulance services, or on our elective waiting list. So it's really important for that. But longer term, I know that if you give people opportunity and further horizons, their health status improves, their quality of life years grow, and their number of and their length of life grows, and we have fewer people demanding services into the future. Now, that's not just a wish on my part, that's evidence-based over many years that we see that in terms of the wider determinants of health. And therefore, the missions that are focused on giving opportunity and hope, the ones where, and the way I see that is the cross-cutting work that I think Niran, you mentioned, which is the London Anchor Institution Network. I am very conscious that the NHS is taxpayer funded. We want to get absolute maximum benefit of every pound of my tax and yours to make sure the health service does what it does. And a lot of that's about efficiency on my part and making sure we get to treat Londoners as quickly as possible. But actually, it's also about the money we spend it on local people who bring that back into the economy. We spend that on local business so that we can actually give businesses an opportunity to grow locally close to our anchor institutions. And we give people a greener, safer environment in which to work. And they're the things they are the ones that, for me, have been most focused. The downside, or the things that I think work less well as not one of the major funding partners, though I must say all of the partners give much time and effort, which we probably haven't counted, right across the board. But as one standing outside of the GLA and London councils in this, is that I was always nervous about being too corralled into an organisation and a measurement regime that took my teams away from delivering healthcare. And we've got to get that balance right. So we need to be able to measure the success we have and have committed teams, but at the same time, I'm really concerned that we don't over-bureaucratise this and make it a measurement, a processing counting stuff rather than in doing stuff. I think that answers your questions, but tell me if you want more.
That more than answers it, and really interesting to, the idea of opportunity and hope being some of the, being something strong coming out of this partnership working just feels really incredibly inspiring, and actually shows some of the value of this work and what is going on. Now, I want to bring Rowena in at this point because Martin has kind of, set out this, this opportunity and hope, and I'm just wondering if that's something that small businesses are getting out of the recovery programme and its work, and just what the, how that's added to the sort of partnership working that's going on, and also how much you, within the Federation of Small Business, have been involved in the development and the delivery of the recovery programme, and do you think there would have been any opportunities to work with partners differently at all?
Yes, it was fantastic to hear about opportunity and hope spoken about, and it's one of the things I like to say, aside from the fact is that small businesses are very much opportunity creators, and I think with respect to recovery in the future, that's really important. However, I think what we're really talking about here, or the question is actually about, is the way that the board was structured and how it worked or didn't or whatever. And I think if we were only talking about the 2 hours that the recovery board met every quarter, with the number of people around that screen, and it was important to have a seat at the table, screen, whatever, but the opportunity to input was very limited from the sheer number of people and the time limit. So it is about more than just that 2 hour meeting. It is about the themes. It was about the sub-working groups. It was about much more in terms of delivery. Now, in terms of just say the 2-hour meeting, it was interesting. I was listening to Martin there, and I recalled a point where, like, there wouldn't be many opportunities where the NHS and the Federation of Small Businesses would have been around the same table and had those kind of conversations. But I remember specifically when, Luke was acknowledging how highly strategic the Recovery Board is, and there was a moment where we were talking about, not a moment, there was a fairly long period where we were talking about how do we increase vaccine uptake. And those were very broad-ranging, high-level discussions. But there was a point in the meeting where Martin was speaking, and he gave an example of one of the ways that we could do this, and we want to do more of it, was about getting employers to talk to their staff, and he gave a very specific example about a construction company, and then he made an invitation or a suggestion in the room of, what other companies could do and what the other business organisations could be taking out to their members and how to do that. And that was really interesting. Like, you walk away from that meeting and you literally put it in your WhatsApp groups and you get the message out far and wide. So it did have impact. There were ideas shared that were able to be delivered immediately just by having those ideas shared in the same room. And I think we did make an impact that way. But I would say beyond the 2-hour meeting of the recovery programme, it was really important that, in that meeting and overall, there was always an invitation to be more involved. There was always an invitation that if you have further ideas on what you've been able to express in this meeting, please get in touch. Here's the person, how to do it. This is what you can get involved in this group. And I think that level of openness was quite significant. Now, there were many different subgroups, and we were talking about themes and how they've developed over time. Like, I remember being involved in what was originally conceived as a return to the workplace group, and then that morphed into something else as, we changed over time. So I think it's important that in that development, our voices, not just in we keep talking about the Recovery Board, and I'm just noting that it's bigger than that. The voices in what was the Return to the Workplace group from the different business organisations and others in that group helped it morph into something else, then analyse and look what was more important over time. And I think in terms of the delivery, yes, there are specific examples of how people walked out of meetings were able to share ideas and then act on them, but also the involvement in the working groups. And Federation of Small Businesses has been involved in all of the themes to a capacity, putting the voice of the small business experience to that. So we've really welcomed it. It's so easy to just say, okay, well, we'll just put them in the high street. but small business impact on so many of the different themes, and it was really important. So I think, looking at the entire structure, rather than just being careful that we don't think of it only in terms of, one small narrow thing.
Yeah. No, well, I mean, certainly sort of having from our side, we were kind of, we were getting briefed on what the SCG was doing, and hearing that example about the vaccines and businesses and being able to, using the Recovery Board process to pick up on that public health messaging issue, it just shows absolutely the value of that kind of working together and the kind of getting out of the silos that that it's so easy to fall into. And if that's something that can be maintained going forwards in a constructive way, then that makes London stronger as a city. I want to move on to looking at the Building a Fairer City action plan. So this is a question for Luke, and I think it was in March 22 this was and then in May 22 it was published, and with an aim of reducing inequality exposed by the pandemic. I'm just wondering, when you say, I'm just at this point in our briefing, that you've begun developing in the November meeting, the GLA stated its City Intelligence Unit has begun developing a set of quantitative performance indicators for each of the plan's 14 actions. So I just wonder when you'll be publishing that set of performance indicators to accompany those 14 actions, which are in. So this Building a Fairer City Action Plan is sort of like a sort of part of the whole piece, but focused on economic, more on economic things. It seems, is that right? Or
there are two questions there, I think. Shall I just place the Building the Fairer City Action Plan in a bit of context first, which is that you know, the big thing that I think that we all collectively learned through COVID was that the impact of the pandemic, whether it be economic, business, health, was not universal. You know, and we all collectively understand that, and that some of the issues were frankly structural. They were things which predated the pandemic, hit during the pandemic, and now, and sometimes I worry a bit that as we move on that we kind of start forgetting them a bit. So the Fairer City Action Plan is a way of dealing with that problem, saying here are a set of actions that we are asking partners across London to galvanise around and come together and to start taking action. And you can see already, whether it's colleagues in the NHS, whether it's colleagues in the GLA family, are starting to review that the economic recovery framework, which supersedes in some cases the mayor's economic strategy and done jointly with London councils, has been put through the lens of that. But I wouldn't, and to your specific point, I wouldn't describe it as as purely an economic thing. It's about the entirety of the challenge that we face with structural inequality within the city. And as an aside, it's another really good example of where the GLA was able to work with a really brilliant chief executive from a borough, Kim Wright, to chair that group, and has brought some stuff around it. On the specifics you ask about the data, sorry, I don't have in front of me exactly when their plans to do that. I think they're working on that now, but I'm happy to write to you and come back to you on when they expect to publish that data, unless you know, Niran.
No.
If you could, that would be really helpful, and it would also be helpful to understand why the indicators weren't sort of embedded in the plan from the beginning. I mean, whether that was because you wanted to do some work before you worked out what the indicators were, or
yes. So I think it's quite important to understand this. So in developing the plan, this wasn't, we just took a data-led approach and we just kind of threw some data down, and then we, set out a whole series of instructions. It was done with the communities and with the engagement. And, I think if you were to speak to some of the people from the board, or indeed more widely who were involved in that, they would say it was really important that we spend a lot of time talking and understanding it, because that's what gives confidence that voices have been listened to. And frankly, the importance of understanding the depth of some of the challenges that different parts of London face. So I mean, I can understand why, looking at it from where we sit today, you might say, well, we should have been much quicker on metrics, much quicker on baselines. But I think, that's a misunderstanding of how best to affect change in this area. Mm-hmm. But we do need to get to them, I agree.
And yes, I suppose also there's the point that Martin made just earlier about being, a bit nervous about being corralled into measurement regimes that potentially become over bureaucratic. So it's kind of getting those.
It's a balance.
That balance, so that you can definitely provide evidence that the work is having impact, but
I give people something to focus on, but not to the point where that takes over the management of the conversations.
Yes. Now, Luke, just one more question, which you may need to write to us about as well, but is when we should expect to see the plan's annual report?
October, I'm told.
October. Excellent. Thank you very much. And then, Niran, what concrete actions has the GLA taken to deliver against the actions since the plan was published?
Is this around the building Vericity
Yes,
action plan? I am going to have to come back to you on that because I don't have the detail, unless Luke you have the detail on that.
I mean, individual parts of the GLA family in particular have gone through it and have set out what the actions they're going to take. I know the GLA itself has been taking very significant steps in its, for example, its EDI work, in the way that it develops its policies, all of which fit within the kind of the plan itself. So I'm sure we can come back to you with some further detail.
I think that would be helpful to have something written. Alison, I just wondered if you wanted to come in on this at all.
I think the only thing I would add is, under Kim's leadership, so Kim Wright from Lewisham, Chief Executive, she has made sure as well that all of the boroughs are cited on the plan as you'd expect them to be, and we're going to use our Chief Executive's London Committee to ensure that we're making progress and contributing as boroughs to our bit of making the city fairer. Some of this data we would already be seeing anyway, in terms of always looking at our workforces and ensuring that they're reflective of the city, and where they're not, what action we can be taking for it, as just one of those examples. So I think what the plan again has done is given us some space actually to be more thoughtful about where we can make some of these differences on the structural inequalities that were so exposed through the pandemic.
Thank you. Thank you, Chair.
Thank you. I can see that Assemblymember Pigeon wants to come in. Can I just mention to everybody that we are now falling very slightly behind on this section, so if we can keep the answers also relatively brief, that would be great. Assemblymember Pigeon, and then we'll move on to Assemblymember Prince.
Thank you. I wanted to pick up with Martin the issue of the missions, because we're very lucky to have your senior input from the NHS throughout this period. Obviously, some of the missions and the work of the Recovery Board focused on wider social impacts. We've talked today, and you've talked about some of the good work there that you've been able to feed into. But are you happy there's been enough focus on health-related issues, given that this whole Recovery Board and work came out of a pandemic? So are you happy with that? And in terms of recovery missions, there are only two that are obviously health-related, mental health one and one on healthy food and weight. Do you think there needed to be another mission that really focused on this issue of transmissible diseases, pandemics or whatever?
So I think that last bit probably is a question for our colleagues in the Office of Health Improvement and Disparities in UK HSA, just what we used to call Public Health England.
Yes.
But I think I am content that we focused on the things where partnership played the biggest role, and at the same time an expectation that my organisation delivers on the things that it's got to do. So I've got to get fewer people waiting for their surgery. I've got to get fewer people waiting in ambulances to go to A&E. I've got to make sure our ambulances get to our patients quicker. That's my job, that's the NHS's job, and we will do that. It would not have been helpful, I don't think, to have set a mission around that sort of thing. What, on the public health side of things, it is therefore really important that we focus on the prevention side. And therefore, if you take the mental, I'll stop at this point, but if you take the children and mental health mission, the focus is not on better mental health services, it is focused on mental well-being. And that is an all organisation play. The answer to mental health is not the NHS. The answer to mental health well-being is societies and we as a partnership.
Okay, and what about, how did all this fit with the Resilience Forum? Because obviously the Fire Brigade and our Deputy Mayor for Fire and Resilience lead on all that and planning for major incidents and pandemics and so on. Is there any duplication there?
To be honest, there's always times when you turn up at a meeting and say, haven't I just all met you before in another meeting? And that inevitably is going to happen, one of the roles I play is working across our agencies and organisations. So I feel like I'm in many similar meetings, but far better that than frontline staff having to work this through. I think there's always a danger of duplication. I think we've been very good and learnt to be very good to say, I don't think that's for this meeting. I do think it's for another space. And the Deputy Mayor Twycross and the resilience piece has also changed over time over a chronic incident. And I think there are benefits of working across the two, but we are now clear that there is a distinct difference in purpose.
Okay, lovely. Thank you for that.
Thank you. Assembly Member Prince, over to you.
Thank you, Chair. This is to Luke. What work is taking place to ensure that there is consistent buying at all levels of the anchor institutions to recovery initiatives such as procurement of small businesses? And more generally, how are you responding to this challenge of partnership working?
Yes, and I mean, thank you for raising the anchors institution network, and specifically the procurement point, because that's clearly an area where the big institutions in London can make a really big difference, not just to directly to their communities and to their day-to-day work, and indeed help their own supply chains, but also I think it provides part of the answer to the question of resilience of the city, that if you have robust procurement, you're supporting local businesses, local communities to supply locally and to help you help them and help you run your businesses, then that is something which is an important employ. On the specifics of your question, Assemblymember Prince, there's a working group that sits drawn from members of the anchor institutions, which comes together, which is looking at a lot of it sharing best practice. Some of this happens a lot already, but it's all a bit people do it slightly differently, and just getting procurement officers in a room to learn and to think about it. And TfL have played a really important role in this. Met likewise. So the working group comes together and it sets out the kind of the expectations and ideas for it. And I think we made a commitment about £1.3 billion. I think we're about halfway there now on that commitment. And I think we should, over time, we should stretch that further, and we should be looking to remove the barriers. A lot of them, frankly, are quite bureaucratic and pointless to local buying and local procurement.
Thank you. I mean, you're quite right about the 1.3 billion. But was there a timeline set when that 1.3 million was set aside? Did we say, well, we want to achieve so much within a given time, or is there a time limit by which you have to spend the money?
Yeah. From memory, and I think it's 2024. So therefore we are on track and confident that we will get there.
Thank you. Does anyone else want to come in on that?
No, just to also say, I think as Luke mentioned, that network I think is a really important point. I mean, they are also developing online learning courses for procurement leads, and also looking to kind of bring sort of new systems in place to help us better procure kind of from small businesses and micro businesses as well. So it is quite a powerful force that's coming together on this.
Thank you. We're now going to move on to Assembly Member McCartney, and we're going to now move to looking at the future of the London Recovery Programme and the London Recovery Board, and you might even reveal to us what the new name is going to be.
Thank you. I think my first question is probably for Luke, and that is just when you were thinking about transitioning to a successor board, what were the general views, and was there ever a consideration to actually closing it at all? Or, what were the options, and how did you come down onto the one you have?
I mean, there was certainly the programme itself is bounded by 2 years in terms of its central support, and I certainly think that when we came to consider the options, closing it down, continuing it, moving something else, were all absolutely on the table. I have to say, and we did do a lot of kind of engagement with board members and then more broadly, I don't think there was any appetite at all for it just to be shut down and to go away. There was definitely a sense across, I think across the city and across the people, our partners, that seeing everything through the lens of COVID and COVID recovery is starting to become unhelpful. And we've had a debate and discussion about did we have the right missions and were they the right things to do. There are other challenges facing the city which the partnership approach, I think, and the approach of the Future Partnership Board, I'm not sure we've quite got there to a name yet. I think that's for the board to decide, but probably the London Partnership Board seems to be the most likely. But that approach, applied to other challenges and other problems across the city, it seems to be the right point to get there. And I mean, in all honesty, when I started the process of thinking about what that would be with Niran and with other colleagues, I did wonder whether there would be some pushback, too many meetings, duplication, all the sort of stuff that we've touched on a bit today. That hasn't been the case, and actually there is a very genuine willingness to continue the approach, and that that's the GLA is responding in terms of resourcing to support that going forward.
Thank you. And my next question is for Niran and Alison, if I can. I mean, when the board was set up, we had a 2-year timescale. But did you have any objectives at that stage that you wanted to achieve? And is part of the reason why it's come to an end because those objectives have been met? I also just wanted to know, if you did set some targets, have they all been met?
So our focus very much has been on the missions. The missions go beyond the 2 years. What we had established for the 2 years was the recovery programme team that was funded for 2 years, and it was really important for us to kind of front load sort of that investment, because we needed to ensure that there was longevity in what we were trying to do, and we were able to sustain the work that we needed to do around the missions. The missions are not yet complete. Some of them go beyond 2025, and those will absolutely continue. In terms of objectives around, probably softer objectives around partnership working, those I would say have been achieved, and now what we need to do is not lose that, because there is always a danger. We've talked a little bit about the lessons that we learned over the pandemic. Structures that we know, structural barriers we know that still exist, etc. None of that goes away. So actually, this is now about kind of how we ensure that we sustain that partnership working through some of the continuing difficult issues that London faces.
Thank you. And the question is also to Alison, but can I also ask, Alison, obviously COVID was a particular time when there was real impetus and motivation. And we often have discussions about where power should lie, whether it should be the regional or local authorities. Do you think that impetus will carry on with local government thinking that it's actually really good to work in partnership in this way?
Just hold that thought for a second. I just want to welcome Angela Spence to the meeting. She's just joined us online as promised at 11:30, and I just wanted to make that apparent to all Assembly members in case you want to put a question to her. She's now with us. Thank you, Angela. Sorry, Alison, to interrupt you just there.
Thank you. So where shall I start? So I think in terms of, I've just lost my train of thought because of that. Sorry, Joanne, can you?
It was about the objectives when you set up the recovery board. Have they been met? But also, moving forward, that impetus point. Is there still the motivation there to really drive change?
So I think they're really helpful questions, and Niran's spoken in the same way I would have done around the missions, and we're really clear that we haven't achieved everything under the missions that we set out to do so far, and the intention wasn't to do it by this date. And we in London Councils, the Committee of the Leaders, have set out some shared ambitions for us to be working together on, and they reflect much of the ambitions that are set out in the missions too. So that's how I think a number of the organisations that have been part of the Recovery Board and beyond are really building into their almost business as usual some of the work to continue, because we know the missions aren't completed. I think that impetus to work together where there is purpose and it's going to make a difference. So I think what we've also learned about, which we haven't said much about today, is also when, and GLA colleagues did recognise this, is when you need to step back and it's not your bag. You know, there is a temptation for all of us in public service to try and do everything and fix things, because that's what motivates us, that's what motivates politicians too, that's what you come into politics, doesn't matter which party you're from. I work in a cross-party organisation. Everyone wants to make a difference. You just might have some different views about how you do that and where to focus. So I think the impetus will still be there, but it will have to have purpose. And I think that means being able to adapt in the way that we've seen from the transition work to the Recovery Board and now to the Partnership Board, having the confidence to be able to do that, and the relationships in the open way that Rowena's talked about, and the trust to be able to say, and sometimes it's not working. And I think as we grow in maturity as a city, we will continue to do that. And the Partnership Board should give us the platform to do that. I think as well what I'd like to see, and I think from a London Council's perspective, but shared across from partners as well, this next iteration of partnership working will ensure that it's not that we're bringing in the voices earlier of the other partners to shape where next, rather than, you know, because it was at that particular time in a pandemic and recovering from it, the GLA and London councils took a bit of the helm. I would like to see, I think from a London Council's perspective, but from all the partners, how those areas of focus for the Partnership Board really are involving others at an earlier stage of that as well, and it will give us that opportunity.
I think that's really helpful. I don't want to tread on some of the questions that the Chair has later on, so I hope I'm not doing. But I think often when we think about boards or so forth, where they often fail is where they might have a purpose, but they don't challenge. And so I'm just wondering, you know, with the last few years and then moving forward, is that ability to challenge, but in a friendly challenge, able to be done?
So what I would say is different about this board compared to kind of other boards, and actually there is some real learning from this that we need to take into kind of wider London governance, and I think it would, you know, it would absolutely feel like the right thing to do, and I know there is some thought going into that already. Is that, and I hope this is true of our partners, that people don't come just to listen to a presentation, or don't, and actually the presentations are not the GLA led or London Council's led. They're actually led by our partners, and there is real ownership of what is being developed, and I think that certainly from the boards that I have sat in on, there is challenge. It is good challenge, and also this willingness to, where it is appropriate to do so, to get involved, and the openness for partners to be in terms of kind of those areas, or those partners that want to get involved. And I think that is what feels quite different about this.
Okay. And I think if I can quickly add to that, Rowena talked about different voices being brought into the room during the period of the Recovery Board. And it really made me think of the young people and the challenge, you know, the shadow road and the challenge that they brought in a very real way, and that all partners were open to listening to that and responding and thinking about how we could do things differently as a result of the experience they were living on a daily basis. And I think that did show the maturity of the partnership and the honesty and openness. We would be prepared to hear that challenge and respond to it and listen to it.
Good, thank you. That's really helpful. My last question really is just for Niran, and this is thinking about the GLA's role under the Civil Contingency Act. Does the transition away now from the Recovery Board mean that we are now formally at the end of recovery from COVID?
That's a really good question. We are still monitoring COVID, and we will continue to do so. As we discussed earlier, the role of the Deputy Mayor for Fire and Resilience and also resilience wider, we do continue to have an oversight. It's not this oversight group, but there is another oversight group that meets, of which we have a number of partners, including the NHS and UK HSA, and we still come together. At the moment, that is, I think it's every 3 weeks. It has the ability to step up to be more frequent if required. But the monitoring of COVID continues, and actually over winter, we didn't just monitor COVID, we also monitored other illnesses such as scarlet fever, the flu as well as kind of other issues that may well impact on us, such as energy and power cuts, etc. So all of that continues to be monitored. So although this ends as the recovery board and transitions into what could be called the London Partnership Board, that's yet to be agreed. Our monitoring of COVID continues.
Thank you, Chair.
Thank you. And I see you snuck in that the decision has not been made yet about the new name. However, that's probably the least of our questions. I'm going to... Assembly Member Caroline Pigeon has indicated she wants to raise something.
Yeah, thank you. Can I pick up with Martin, actually just picking up from that conversation? Do you think this is, we're beyond... at the end of the recovery stage for COVID-19? It doesn't feel to me we're quite there yet.
So in terms of the pandemic, technically that continues. The World Health Organization declared a World Health Emergency on the 30th of January 2020. It is due to meet and to reconsider that decision shortly, I'm told. But that, I think the phrase we use nowadays is beyond my pay grade. We are still seeing significant impact of COVID as a disease. I would argue that flu has been more impactful this winter than COVID. And we are accommodating our response now to COVID as business as usual. I don't want any Londoner to think they haven't got a responsibility and a part to play in stopping infection spread, be that Group A strep, be that monkeypox, be that diphtheria, be that COVID, be that flu. But I think we now have to, as a partnership, focus on building further in London rather than just referencing COVID as our starting point for everything.
And the new partnership board, do you think it's got everything right to help deal with any future public health emergencies beyond COVID, or do you think that's what other things like the Resilience Forum and stuff are for?
So I think the broader relationships that we've already alluded to are really strong. The Resilience framework works really well. We have a number of ways to test things out, etc. But actually, if you take it away from who is a level 1 responder under the Civil Contingency Act and say, right, how do we need to operate as London? The Recovery Board has been, the new board will be an opportunity, as Rowena said, for us to really meet in a way that we've never met before and build on those opportunities. And there will be further public health emergencies. There will be further economic emergencies and social emergencies that this city faces. We need to work on those together.
Lovely, thank you. That's very helpful. And can I come to Luke or Niran now, just to understand the membership of this new partnership board? I don't think you've touched on that. I haven't seen an organogram anywhere. Explain to me how this all works together. Is it going to be the same membership, or are you planning to change that?
It's certainly an evolution of the membership as opposed to a fundamental change. So we're just working through that with partners now, thinking and putting some recommendations to the co-chairs on what that would look like. But my expectation is that it would there'll be some people who, for personal reasons or career reasons, will have moved on. There'll be some people, but the overall makeup of the board will feel very similar to the partnership board. I think to the recovery board. I think the key difference is recognising a slightly wider scope. So we haven't touched, for example, today on housing, but the idea that housing isn't one of the big challenges facing London and deserves some focus would seem amiss. So I expect to include some voices on housing. I think there may be a bit of rebalancing on some of the areas. So we have making sure that, particularly in the community sector, voluntary and community sector, probably being a bit more active with them about how we select and choose the people that we recommend to the Mayor and to Councillor Gould as members, so they feel that they've got some buy-in and some insight. It'd be interesting to get Angela's view on this, but making sure that they feel that they kind of understand their role and what purpose they have. So broadly, shortly, an evolution, but probably with quite a lot going on underneath to make sure it's the right people.
But you're saying people have moved on, but presumably you hadn't appointed individuals because of who they were. It was their role you had appointed, really, or their organisation they were representing. So will you be dropping some organisations?
I think in one or two cases we will be in conversation with them. They feel that, they were there for the pandemic and the specifics of the pandemic, and actually they've got other forums and other places, and I think that's it won't be a large number, perhaps one or two, and we'll come to that when we've made recommendations to the Mayor and to Councillor Gould, but a very small number. And specifically, there are some people who represent national organisations which now, as we move to a partnership stage, actually have argued with us that it'd be better if we had someone with a much better London feel to it. So it's that kind of thing. That's when I talk about individuals, that's what I mean.
Okay, and it still have two co-chairs?
Yes, no, absolutely. And I think, Alison touched on this in her opening comments. I think we would I think we would really struggle if we didn't do that, actually. And I think that is a very important symbol of the partnership. And I think trying to find other partners on the board and providing them with opportunities to lead parts of the work will be important as well.
Lovely, thank you. Angela, did you want to come in there to talk about future membership of this new partnership board and the thoughts from the sector you represent?
Yeah, thank you. Thank you, Chair. I guess being there on the board as the voluntary sector representative, that's been a real opportunity, I think, for the voluntary community sector to be around the table and to have that equal input and insight as all of our other colleagues across the various sectors. So I welcome that. I think moving forward, I think there is a challenge around how many voluntary sector representatives there are. I think it can be quite difficult if there's me, and I've spoken before about capacity. It's quite challenging in the voluntary community sector to ensure that there is capacity to support the sector to engage in this process. So I think certainly more voluntary sector representation on the board, and certainly representation that has a reach that goes right across London, I think would be really helpful for voluntary community sector representation in the future. And, expertise, I've spoken about the importance of having the expertise around the understanding of local communities and deprived communities and inequality and access to services, all of those things that we see as really important as part of our role of the voluntary and community sector. So I think it's really important that as long as we continue to ensure that those messages continue to come through the work of the voluntary community sector, and we're considering that as part of the future membership. That's what I see as important in terms of who else we might want to see on the board from the voluntary community sector.
Thank you very much. I mean, I hear that quite a lot from sort of chief execs, senior officers from voluntary sector sort of umbrella bodies in the boroughs, that they're asked to be on every partnership board, but actually they don't have the capacity and they're not really paid to be doing that, and they're really stretched. I wonder, Niran, as you're developing this, and Alison, are you taking that on board? Because it's absolutely crucial we have that voluntary sector in there, but actually they've got a day job to do and they're very stretched.
Yeah, absolutely. And and we have been conscious of this throughout, and it's so incredibly valuable to have their voice around the table, but also understanding kind of where for instance, the work that that Kim has done, Kim Wright has done, that has been led from a borough leader. Obviously, that is not something that we would have asked the voluntary sector to do because of their stretch, but their voice is really important to us, and we need to absolutely find that balance without putting too much burden on them. Absolutely understand that, but at the same time making sure that they are part of this.
Lovely, thank you very much.
Yes, I think the voluntary sector is very much under stretch because of the way in which the funding relies on bidding, and many bids, of course, if you say, I'm going to spend a lot of my time as the chief executive out of the building involved in these coordinating groups, that's not exactly likely to help win you a bid, is it, for funding, because that's the kind of overhead area that most funding bids have no interest in including, and that's why we're now in a very difficult position with the voluntary sector. However, that's a personal but obviously not an entirely private hobby horse, because I've just shared it and I watched a lot of people nodding while I made those remarks, but I am going to move on to Assembly Member Onka Sahota, who's going to continue to ask about the move to the future. Thank you.
Great, thank you, Chair. This is for you, Niran. How will the transition to successor programme impact on the recovery missions, given they're intrinsically linked to the London Recovery Programme?
Yeah, so the recovery missions will continue. As you're aware, some of them go way beyond 2025, and the monitoring and development of those will continue to happen through this board and through this board structure. So although we're transitioning to the London Partnership Board, what we're looking to do is kind of widen the remit as opposed to kind of reduce the remit of the partnership board. As you're aware, the recovery team itself that oversees the board and the recovery programme does step down because the funding comes to an end. But we have plans in place with this new unit I'm creating, which is the Strategic Partnership Unit, to build in the continued work that this team does into there. So we're not losing all the resource. We are still maintaining some of that resource to continue that work, and also the delivery of the missions will continue as part of our, particularly here in the GLA, as part of our business as usual. So that will absolutely continue.
What impact will this have on budget setting?
So the budget setting continues as is. So as you are aware, even with this year's the 23-24 GLA budget, the way in which the budget has been set around the missions, and that will continue.
Okay, and how will the targets from the London Recovery Programme be monitored and maintained?
Yeah, so as we said, we are going to publish where we are to date against each of the missions. I can speak here for the GLA. Obviously, partners will have different ways of kind of monitoring and measuring their targets, but we certainly use our performance reporting and the dashboards that we have to monitor against those missions, and that is actually going to continue. So we have got agreement from our performance and governance team here at the GLA that will absolutely continue happening.
And looking at the draft 23-24 GLA budget, states that the GLA's annual funding for the London Recovery Programme team will reduce from 0.8 million to 0.2 million.
Yes.
Does this reflect an intention to rein back some ambition in transitioning to the successor programmes on the board?
So the answer is no. So the recovery team, as I said, had funding for 2 years, and that is the 0.8 million pounds worth of funding that it had. My plan very much, and this is very much consciously done, is the creation of this new strategic partnership unit will retain some of that resource that will continue, because this is so important, and the way in which we're developing that strategic partnership unit is very much based on kind of the really good work that we have done here and the lessons that we have learned, and what it does is it basically puts this on a more sustainable footing by bringing it together into a slightly bigger unit where I'm bringing existing teams together, but also kind of maintaining that focus. So the new assistant director, the new role that we've created that cuts across both our public affairs and partnership working, which is also a fairly senior role, will absolutely focus on the continued work of this transition to the new partnership board. Yes, and the reason for that, so as I said, we absolutely front-loaded the building the structures and putting the structures in place. What we have done, and through the work that Luke has done on the transition, is that we have slimmed down some of those structures, and through lessons that we've learned in terms of kind of reducing the amount of sort of bureaucracy that we have around this, and kind of keeping it very, very focused, both on the programme and both on the board going forward.
If I may add, I mean, we've had a very deliberative process of looking at the tasks and the programmes that we have within that central team, and identifying parts of the GLA and indeed other partners that will own and take those forward. So, Youth Recovery Board is a good example where we've provided a lot of the support for that up to now, making sure that's a success. We have worked with the teams as they're part of their budgeting process to make sure that they own it. And I do think there does come a point where having a separate programme team which is purely focused on one area can have a slight, if it's got lessons learned, it should be working to distribute and get that mainstream as part of business as usual. And it can be slightly disruptive to have a team, and I know this because I've been doing some of the disruption, to have a team which is centrally setting up a whole load of separate agendas and ideas and things. There's a moment in time for that, but there's also a moment in time to hand back and hand on. And I think if we kept going in this way for much longer, I think we would start to lose our traction. So I think there are benefits to this.
I mean, it's something which we should be keeping an eye on, because I think the challenge is how can you reduce budgets by 600,000 and still keep up your quality of work. If you can crack this one, a lot of Londoners will want to learn from that.
Thank you very much, Assembly Member Sahota. I'm going to move straight on to Assembly Member Caroline Russell.
Thank you, Chair. This is a question for Alison, which is how you think that all partners can ensure that there is a continued sense of shared purpose in the successor programme and board, as there was when the kind of the immediate threat and concern about the pandemic was unifying everyone on the London Recovery Board.
Thank you. So, as I touched on earlier, I think that's what we learned through the pandemic, wasn't it? That when there was a common purpose, we could really come together to tackle not just keeping London safe, but then moving into the recovery missions and working together. So I think in terms of that clarity of purpose, it's how us in London councils with the GLA and the other partners around the table form that, when the first partnership meeting comes together, begin to form that agenda and focus of purpose going forward. And what are some of those significant challenges in London that together, differently, we can start to tackle. And as Luke has said, housing has been a theme that has come up in many of the conversations, not a surprise, as an issue that Londoners are facing, for instance. At the moment, we're planning to really focus in on retrofit. It's part of the New Green Deal mission, but absolutely is a significant challenge that the boroughs, working with many others, are leading on, but we're nowhere near achieving that yet. So how we get the money in, how we work with individual citizens about how their homes will need to be changed. Mm-hmm. It's a massive task that we all face that challenge together. So I think it's really how the board comes together and chooses those significant things that they can gather around differently, because they're hearing that that's the issue for Londoners, whether it's business or citizens, all of the time. And I think housing's a good example of that, but also climate change. All the data is showing us that, Londoners are concerned about that, rightly, but they don't quite know what they should be doing to help make that difference, and how it comes together with all of the other pressures that they're facing. So that, I think, is how we build and continue to build the purpose. and have confidence to adapt that as we go. And I think that will be tricky at times because there will be different views. There's no doubt about that. But as we've heard before, we need to be able to hold in the partnership those different views. That is really important to its success.
Thank you. That's very, very, very clear. I just wanted to briefly bring in the other three partners that we've got. So if I go to Rowena, and then I'll go to Angela, and then to Martin.
Speaking quite broadly, really, I think it almost feels like we're at a starting point again where we have this opportunity to build upon pandemic-era policy innovation. And there were several points during when different Assembly members were speaking where I was thinking about different ideas around that, and whether it's about trying to close the disability entrepreneur gap by redressing the disadvantage at the point of recruitment, whether it's looking at the biggest barrier, which 42% of small businesses perceive to be skills, whether it's talking about responsible procurement, and the fact that we absolutely welcome that I've forgotten the word. The anchor institutions have actually set a target around small businesses, and the chance to talk to encourage more local councils to set targets also. Like there are so many different parts, and as I've spoken about the value of being around the table with several different people and coalescing between show girls and really just finding new ideas and approaches that you maybe haven't found. Like I'm glad that we're having this conversation to review what the Recovery Board has done, but also look at what will happen in the future.
Yeah, thank you. Angela?
Yes, I agree with Rowena. I think it provides a really good opportunity to build on what we've already done, and particularly some, the ways of working, the ways how we've, together as a board, shared our expertise as well and our understanding of what's happening, and we can take that and build on it for future partnership working. And I think, for me, certainly, housing and homelessness is one of the critical things I think is really important for the board going forward. And, knowing, with the cost of living crisis and what might be the longer term impact. And certainly, we know that there's people living right on the edge now who could be tipped into homelessness. And, so I think having priorities that are really going to help focus us, but take the learning from what we've done before, how we've worked together, how we've worked with communities to engage in the process. We recognise that voluntary organisations help engage in the process of helping to shape what needs to happen, in helping to feed into the priorities. There was resource there to help them to do that as part of this process. So take that learning in terms of how we now go forward as a board and utilise those things that we know work for us. But for me, homelessness and housing is critical for the future thinking of how the board works together.
Thank you. And Martin?
Yeah, but I can't add much to the content that colleagues have said. I'd echo Angela's point about housing and homelessness, and in some ways they're two different issues, but they're clearly they overlap. I think the key for me looking forward is that we do at London level as a partnership what is best done once across the city, across agencies and sectors, and really trust that where possible we do things at neighbourhood level first, at place and borough level second, and at institutional level third, before we start to think what we do across London. And we put our best combined efforts together where there are issues that are irresolvable by separate agencies or at those more meaningful levels of society. The one thing that I've learned very many things over COVID, but one thing that I've been taught, which is counter to my nurse training, is that actually people know best about themselves, and that's difficult for a healthcare professional to remind themselves when you train to tell people what the answer is. But we've got to really make sure that we do stuff once for London where it works, and let communities and neighbourhoods work through the things that they're best placed to work through.
That's really helpful. Thank you very much, all of you. So my final question is for Niran, which is how will you ensure that the successor board's remit doesn't duplicate the work of other established boards, and how will you interact with other boards to ensure effective partnership working? And I suppose that goes back to what Martin was just talking about, the communities, that neighbourhood level. If decisions can be made at that level, then that's fantastic, and they don't need to go up the chain to a more institutional level. So yes, if you could bear in mind what Martin was just saying as well.
Sure. So one of the things that we are doing as part of the transition is to ensure that there is no duplication. So that in itself is a really important point. London governance is quite wide and quite complex, and it's really important that this board's remit is quite specific, and actually we work through some of the other London governance that we that we have. So the duplication point is a really important one, and that is something that we're working through. The other thing is the lessons that we have learned, the things that we have learned through the work that we have done through the Recovery Board, as I touched on before, is something that we are really keen to kind of share with the other London governance that we have. So kind of our GLA-led boards, our London Councils-led boards, and we're starting to look at those quite specifically in terms of how those have worked. And you're absolutely right. There is, the one thing that COVID has absolutely taught us, and I say this in terms of kind of even how we interacted with government, the kind of understanding of what was happening within our communities and hearing those community voices has been absolutely critical, and that's why we have the representation that we have on this board, and we absolutely want that to continue.
Thank you very much. Chair, back to you.
Thank you. I've got a few questions which I think we've touched on several of them already, so I'm going to say if there's something additional that Rowena, Martin or Angela want to add to their previous answers, then do, and then I'm going to come back to Luke and then Niran finally for some final comments. But is there anything that you would like to add, Rowena, Angela or Martin, in terms of the benefits of transitioning to the new partnership in the future? Or do you feel that you've said everything about that you wanted to say earlier on? You think you said everything that you needed to say? And in terms of identifying the priorities, I think pretty much everybody has said they want to see housing and homelessness included in the future. Is there any other priority that you can think of so far that nobody has touched on, Rowena, Angela or Martin? Happy to take you in that order, or if you feel that all the priorities have already been covered.
Only to acknowledge, I suppose, I think it was Alison's point about she was talking about retrofitting, I believe, at the time, but it applies to many things. The need to build greater awareness and what a mammoth task that is and how we do it. So I think cross collaboration is key to that. So yeah.
Yes, I think that's a very good point, because obviously if you want to increase awareness, if everyone's using the same language and terminology and putting the same messages across in the same way, we're much more likely to get those messages out to Londoners as a whole. And again, to Rowena and Angela and Martin, how can the successor board ensure its remit is tight and focused enough? We've talked about the fact that it's in fact also not going to be time limited, so we'll come on to that in a minute with Luke. But can we make sure it's tight and focused? Because obviously the previous one worked very well because of the structure with the missions. Can we do that with this one? I can see them. Oh, I'll take Rowena and then Martin.
I suppose I'm just going to add a personal point following up on Angela's point rather than as an organisation point. Capacity. I mean, I am a volunteer as a London policy representative at Federation of Small Businesses. My full-time other job is running my small business, and it helps me bring my own experience and those of many of my colleagues and the wider network across London. But I appreciate the way that it has been set up and approached so that it is welcoming and enables me to participate. And I think, just as Angela pointed out, keeping up that ability to have many different voices and enabling them to do that.
Okay, so keeping that focus on the partnership work. Martin?
Yeah, the thing that will, for me, show that the partnership continues to add value is that I am held to account by my board and I am held to account by my network for what we do in that partnership space. So I think it's really important that I'm able to describe to 33 hospital trust chief executives and boards that actually what we are doing collectively is of value to the city, equally to our 1,600 GP practices. So that's how it'll keep us focused and tight on the things we have to do collectively.
I think none of us are now jealous at all at the idea of having to report to 33 hospital trust chief executives and 600 GP practices. But yes, that's quite a lot of reporting back and justification of being involved in something, isn't it? Yeah. And Angela, did you want to add something?
Just quickly, I think just to your previous question, I was reflecting on that and thinking how important it would be to retain the cross-cutting theme of structural inequalities in the work that we do going forward. I think that's really important. We've done that through the previous work that we've done, and it'd be really good to continue that as we go forward. So keeping structural inequalities as cross-cutting for whatever we choose to do as a priority. But in order to keep it tight, I don't have an answer, except I think it's helpful that when we do have a framework, it is time bound, so we're all really clear about what is it we're trying to achieve and by when. So I found really helpful that we had quite a clear time frame for the London Recovery Board. So just looking at what the potential time frame could be, whether it's 3 years or 5, but something that gives us real clarity on what we want to achieve by when.
Okay. Well, Luke, how are we going to measure the success of the successor programme and board? And given the new structure is not going to be time limited in the way the recovery board was, how are we going to achieve what Angela has just said, which is have specific targets? But also, how will we make sure that as we're travelling towards them, that we can review priorities and the areas of focus? Because that's clearly been something we've done in the first iteration.
Yes, and it's something we've given quite a lot of thought to already, because I think it's worth going back to think about kind of why the partnership board was why the recovery board was successful, and what sits behind that. And I think there are two things that I would suggest. The first is a real understanding of where partnership working and that group of people coming together can add value and where not. And Niran touched on some sort of work we're doing to think about how this might fit into other boards and other structures. So I think a really good understanding of where we add value and we can support it, and actually being quite articulating that and thinking about and discussing it, not just going, having an assumption about it. So that's important. The second thing, which I think is really important, is to be led by Londoners and to be led by Londoners' priorities. There was a lot of work done at the start of recovery to think about engagement and to listen, to use the channels that we and other partners had around engagement. And I think we continue to do that. So we've talked a little bit about what the new partnership board might do in terms of its additional areas. I think probably one of the things we've learned is that we need to focus on a smaller number of bigger challenges. And I think as well as keeping on with the missions, but in taking work on, thinking about kind of the priorities of Londoners. And I would add, we haven't, for example, touched on crime and security, which I think is a really big challenge. Londoners always tell us that's a big challenge, and we haven't done a lot of that in the recovery board, and I think the future partnership board would come to that. So I think they're the two areas. In terms of measurement, I think there's something about the checking in and discussing with the partners the value that they're getting from it, and how we measure that and how we do that over the course of time, I think will be really important, because otherwise it will just drift. So I think there's something about the kind of the qualitative analysis of the going back, always evaluating, always testing yourself, always challenge. I think that is something we'll need to build in. And then, I think there'll be natural points and breaks in time around elections and changes in political direction things which will be an opportunity to review where we are. But ultimately, I will always come back to all of this, which is that there's not much point in doing it if Londoners don't feel that it's adding value, and that making sure that we use that data and keep that data going through the City Intelligence Unit and all the rest of it has to be the lodestar, and that's the thing that we have to face towards.
Okay, thank you very much for that. I'm going to ask Niran if you'd like to comment on any of that, but also how will the successor board ensure oversight of the UK Shared Prosperity Fund? So those two areas.
So in terms of the role of the board for the UK Shared Prosperity Fund, so it's providing advice to help ensure investment and complements other activities and meets London's wider objectives. The board also supported the development of the UK SPF 22-25 to 25 investment plan for submission to government in July 2022, and that in itself is really important, because there is something about kind of London, as we said before, kind of speaking with one voice around this. And one of the things I would say around the work of our bid for UK SPF as London, and I say this, this wasn't my role; it was the role of other policy areas and also boroughs coming together. Was the care that was taken around that, and the role in which the board will continue to play in terms of how that investment is being spent and being worked through. So that in terms of UK SPF. In terms of kind of building on what Luke said, I keep going back to this care point. It is so critical. The one thing I do want to do is thank both the partners, but also the recovery team as well. I know that they are stepping down and we are rebuilding in a different way. But the work that they do outside of the programme board to ensure that there is space and time, particularly for kind of our partners whose time is really stretched, to have a voice is critical. And that needs to absolutely continue as we go forward. Thank you.
Thank you. I've just seen that Assemblymember McCartney would like to come in for a final question.
Yes, if I can, it's just to Luke and Niran, really. It's about the point about duplication and accountability. So if, for example, you're bringing policing and crime into the recovery board, we've got set structures here. MOPAC has oversight, we scrutinise. And if work's going on in another place, I think you just need to think extremely carefully. Otherwise, I suspect we as Assembly members would be saying, well, what's our accountability mechanism to that?
So that goes to the value point. So you wouldn't, I would expect, to take an issue to the partnership board that didn't that couldn't be dealt with somewhere else. And I think that where you might be looking on, say, something like crime, and housing is another good example because there's a very good set of structures in place already around housing, is where there are partners which perhaps in the other spaces are not represented, whose voices aren't heard, who might have a different way of approaching a challenge, to have a discussion. I mean, the accountability will still sit with the organisations that have the existing accountability. There's no sense of undermining that. But what they can do is perhaps help steer the direction and the approach of the strategy setting, performance management, and so forth and so on. And indeed, there'll be requests of, I don't, maybe not the best example, but there may be. I'm trying to think of a good example. So there's definitely requests of the board where we're asking board members to help deal with a particular challenge and issue. So there's sort of, it's not just down, it's up as well, and I think that's part of the sort of the approach.
Can I suppose just like a really practical, like I guess an example. So COVID and how COVID is dealt with is very much the role of our healthcare professionals. It is not the role of the board to kind of steer the development of that or anything else. But actually, it's the support that the board and their partners and institutions can provide in kind of driving forward some of those those policies. So a really good example was vaccine rollout. How can we ensure that this is reaching out to to a lot of our partner organisations and kind of actually using that to kind of go right down into our communities, etc. So for one moment we will not be delivering on policing and crime. That is a very, very, very specific task, which where we have really good governance around there. It is actually about how that area and those issues, how the partnership board can provide kind of either, you know, sort of the view of their communities around this, but also just how they might be able to help and support. And I think that's the thing that we need to keep focused on. It is not for 1 minute going to replicate or duplicate any of the work that's going on in other governance areas.
Thank you. I think that's reassuring, but I think even in that, I can see areas that there is going to be inevitable duplication. So I just think there's a real issue.
We will need to keep a really close eye on that. And I think that when the board kind of develops in the next stage and agrees, you know, sort of what its focus will be, we will need to absolutely bring in kind of the wider governance to ensure that there is no duplication.
I do apologise, but the police and crime part, I think, is an interesting one, because I would hope if those structures are working appropriately, they would have the voice of many communities on them.
Yeah.
So I think what you're saying is that knowing that the recovery board is about mobilisation of some of that help.
Absolutely.
Okay, thanks for that final question. I'd like to thank all of our guests. I'd especially like to thank those who've come to the building and don't normally work here. So Rowena, Howie from the FSB and Alison, Griffin from London Councils. I'd like to thank our online guests, which is Martin Machray and Angela Spence from the NHS and from Kensington and Chelsea Social Council, but also Niran and Luke, who've obviously picked up a lot of the questions as we delved into the details. Just launched on the staff intranet in the GLA is a questionnaire, so welcoming staff to give their feedback on enabling the as the transition takes place from the recovery board to the new as yet unnamed partnership board, to capture the successes and knowledge gained from the recovery programme. So I think we're encouraging staff to complete that by the 17th of February, and I'm sure there'll be some reminders that go out. What I would like to also say to our guests is, as we've now come to the end of our questions to you, you're very welcome to stay for the rest of our agenda, but do feel, if you want to leave, that we won't take that the wrong way. So it's up to you. I'd now like to ask the committee to note the report that we received as background to putting questions to the invited guests.
Noted.
And I'd also like to ask the committee to delegate authority to me as the chair, in consultation with the deputy chair and the party group lead members, to agree any outputs from the discussion that we've just held.
Agreed.
Thank you. The next item is item 6 and item 7, which are both they both relate to proposed changes to the GLA establishment. The first item is on transport infrastructure and connectivity unit. And the committee is recommended to respond to the Chief Officer's consultation regarding the proposed changes to the establishment in the Transport Infrastructure and Connectivity Unit. Can I see if anyone has any comments that they wish to make at this time on this paper? I can see Assembly Member Russell.
Just very briefly.
Yep. The officers are just coming round. So they're just coming round.
Right, okay, well that's he should be monitoring us for when we got to this point. Do you want us to break very slightly?
No.
Right. He's not here. Is it comments, I think? Okay, I'm going to restart the meeting. Right, I'm going to restart the meeting and I'm going to go to Assembly Member Russell.
Sorry, I think it makes sense for us to wait until our guests are here for this bit, but could we deal with a different one of the other items?
So we'll come back to the proposed changes to the GLA establishment, items 6 and 7, in a moment. Item 8 is the GLA Oversight Committee work programme, which is on pages 97 to 100, and the lead officer is Deanna, not Gino, at the moment. Can we note the committee's work programme for 2022-23?
Noted.
We're coming to the end of it, of course. We've just got one more meeting. Item 8 is, in fact, the date of the next meeting, which is on Wednesday the 15th of March at 2 p.m. in the chamber at City Hall, so in this very place, in about 6 weeks' time. And now that Phil and Alex have joined us, we'll come back to item 6 and item 7 and the proposed changes to the GLA Establishment, Transport Infrastructure and Connectivity Unit, and then also the GLA Economic Development and Programme Unit. Assembly Member Caroline Russell.
Yes, I just wanted to say this sounds like this new Transport Infrastructure and Connectivity Unit sounds like a very sensible proposition. I would be interested just to hear from officers your kind of broad, a broad summary from you on what you think the benefits of it are.
Absolutely. This isn't a new unit. It's an expansion of an existing unit. But the fact that we have both been able to secure the funding from the lane rental income to expand it, and I think even more critically, to extend it. So rather than a 2-year funding settlement, we've secured a 5-year funding settlement. Gives a clear sense of the value that the industry places upon this. Essentially, there are 3 elements to it. There is the street works element to it, where we have developed a set of data tools that allow us to track where street works are planned by utilities over the coming months and years, and then initially the team themselves have used that to identify opportunities for shared street works, for example, laying fibre at the same time as the street has been opened up for works on the water network. More recently, we are starting to see the utilities who have access to those data tools using them themselves and actually moving beyond us having to be the direct convener and to take advantage of that opportunity themselves. That has been driven by some great work that the team did to get Ofgem to embed in the latest price review for gas and shortly for electricity companies what they call an incentive to collaborate. So there is a financial incentive to them now in the way in which the regulations are set up to do collaborative street works, and that was driven very strongly by this team. In terms of benefits, we think the works that the team has itself convened and sort of led, the collaboration have led to benefits for Londoners valued at about just under 10 million, and that's driven by about 939 days of saved disruption. So street works that would have taken 939 days more if they had been delivered in sequence, having been delivered in parallel instead, and saving that time disruption. So that's the first part, and that was where the service began, and where perhaps its most mature and the most direct benefits have been felt. But we are now able to use those data tools and the knowledge and the contacts that we've generated, to work with boroughs on long-term infrastructure planning. This is very closely related to the decarbonisation agenda. We are looking at both the infrastructure needed at a sub-regional level to enable us to decarbonise the energy system, and the infrastructure needed to be able, for the water system to be able to respond to the impacts of climate change. And that then feeds into both planning for housing and development, because in many cases we've got a better chance now to sort of to align infrastructure delivery to housing with longer term plans, but also discussions with the regulators about levels of investment needed. And then finally, we also have what we call the development service, which is looking at supporting boroughs, effectively acting as a middleman between boroughs and developers who are trying to make housing development or commercial development happen, and the utilities and the regulators who are keen to manage the costs for consumers of new infrastructure, and there's been some real kind of troubleshooting successes from the team, of which probably the most critical so far has been around the interaction between new data centre capacity in West London and the housing development pipeline of those West London boroughs. A data centre takes an enormous amount of energy, and as much energy as a development of some 20,000 houses. I think it's 20,000, not 2,000, but I may go and double check that. But either way, it takes up the energy of a lot of new dwellings. And the way the regulatory system works, new connections are a bit like a taxi rank. So the person who comes along first gets the connection. Housing developers have generally put their requests in quite late because they want to manage costs as far as possible and to push as much cost back to the point at which they start to have income coming in from sales. The data centre, for whom energy is such a critical issue, get them in right at the very start. And we found ourselves faced with an issue where data centre provision in West London had sucked up the available capacity for new connections to the grid through until 2029. And the team have been able to do an enormous amount of evidence-based work to convene the different parties and to find solutions by looking across different distribution providers, looking at how you can work at the edge between UKPN and SSM, both of whom operate in South London, and how some of the data centre capacity could be delivered sequentially that would allow housing capacity to be delivered, capacity of housing to be delivered alongside that. So it's a real kind of troubleshooting process.
Just to be clear, did you say that the ability to make these into permanent roles has come because of the regularisation of that income from lane rentals?
It's the extension of the lane rental income. Previously, we've only ever had it in 2-year deals, and it's quite difficult to recruit on a permanent basis when there's such a short period of certainty. Mm-hmm. We now have a 5-year deal. I mean, clearly that's still not permanent, mm-hmm. but I think if you're appointing someone on the basis of a 5-year funding stream, it is sufficiently long term. Yep. And I think we have sufficient certainty now from the utilities and those who manage the lane rental income that they see the value of this service, that I would, there are never any guarantees, but I would be surprised if they didn't want to continue funding it beyond the end of this deal as well.
Thank you. That's really helpful and very interesting to hear. I mean, it just feels like a really strategic approach and really useful for Londoners.
Well, if you would ever like to have an informal briefing in more detail on the work that the Infrastructure Coordination Service do, Molly Strauss and the team who run it, I mean, I would be happy to take part as well, but Molly and her team are the experts, and we would be more than happy to arrange that for you.
I'm sure that's something that we can take up through Committee and Scrutiny Services. Thanks for that offer.
Thank you.
Can I just check, just on the point about the funding, is all of the costs associated with the unit completely covered by Exeter, or does any cost fall on the GLA?
There hasn't historically been any cost to the GLA. We've managed to cover all of the costs via the lane rental funding and some government grants that we receive, particularly for our work on what's called the National Underground Asset Register. However, as we move into this new phase and expand the team, we are, on the one hand, combining the lane rental income with income from developers, from utilities, we hope from boroughs. We're beginning the process of engagement with boroughs about contributions from them, but not unreasonably, those organisations have also said, well, we are happy to contribute, but the GLA gets a benefit from this as well, so we would like to see you put your hand in your pocket. So we have agreed, as part of the most recent budget, in the current draft budget, a GLA contribution of £500,000 a year to the cost of the service as well. The lane rental income covers the entirety of the staffing costs. The income from other sources then pays for much of the programme delivery cost, because that then allows us to scale up and down the level of programme delivery we're doing, depending on the level of income we achieve. But I mean, we are seeing those partners increasingly willing to provide the support we're looking for.
Okay, so there's a possibility that with the subscription fees from developers and
Yes.
accessing services and subscription fees from boroughs,
Yes.
so on and so forth, that the £500,000 could actually go down if we manage to persuade more people to subscribe than perhaps we're anticipating at the beginning, is one question. And then my other question is, the Lane Rental Governance Committee has not yet met to agree that the 10 million for the 5 years
Yes.
is absolutely agreed, and that's going to take place later this month, is that right?
Later this month, yes.
Right.
I mean, they have met and discussed the proposals in draft on a couple of occasions, and the feedback has been positive. We have also presented the proposals to the London Infrastructure Group, which comprises the chief executives of most of the organisations who are represented on the Lane Rental Group. So we are pretty confident that we will receive the approval. But no, they haven't formally signed it off. And as the paper acknowledges, if there is a surprise and we don't achieve the approval that we're seeking, then we will have to relook at these plans.
Yes, you've obviously anticipated my follow-on question, which would be, if we don't get the 10 million approved for the next 5 years, we won't be committing £500,000 of GLA money to anything. No. And can you just tell me, if we do manage to get extra subscription fees in, would that then reduce our contribution?
I think on the latter question, it would give us the opportunity to look at whether we wish to reduce our contribution, though we would have to build up, I think that would be more likely to happen towards the end of the budget period, as we have assumed a relatively...
Well, I'm operating from a very positive frame of mind here,
Indeed.
Which is that the organisation in this way is going to continue to prove to be of benefit, and that people, developers, boroughs, will want to subscribe. So
Absolutely.
I just wondered if that might then help us reduce our expenditure.
It could do. If we overshoot our targets, then we've got a choice to make as to whether we want to reduce our contribution or whether we want to try and deliver more.
Okay, I just thought I'd make those points. Anyone else from the committee want to come in? So, item 6, the proposed changes to the GLA Establishment Transport Infrastructure and Connectivity Unit. The committee is recommended to respond. Are we minded to respond positively to this consultation? I think that's unanimous. Thank you very much for that, Phil. No then we've got the proposed changes to the GLA Establishment Economic Development Unit and Programme, which again is Phil but also joined by Alex. Does anyone have any questions that they want to put at this point, or is everybody content to move on to the recommendation to respond to the Chief Officer's consultation? And are we minded to respond positively to this one as well? I'm seeing nods all around. You've been let off very lightly. Okay, thank you very much. So that leaves us, if we go back to the agenda, I've dealt with the next two items. We have the last item, which is any other business the Chair considers urgent. The normal process is to say none. However, this is actually apparently going to be Davina Toimbo's last meeting with us, which I know is a frightful issue, but of course it's her last meeting with us because she's going off to take up a very prestigious role elsewhere. So our loss is very much another organisation's gain, but I think on behalf of the committee we'd all like to thank you for all of your support, both in this committee and also across the piece from committee services in many other committees as well, and plenaries and MQTs and all the rest of it. So you will be much missed, I think, will be the short so it seems that the committee were quite content that I introduced some other business that I consider to be urgent. However, there is no other business that I consider to be urgent, and I'm then closing the meeting.